Good afternoon, everyone. Thanks for braving the ice and coming out in person today. It's lovely to have a foolish crowd in this lovely room. My name's Jim Farney. I'm the academic director here at JSGS, and I'm really happy that, well, given the title of the talk, happy is not maybe the word. Honored that Senator Yvonne Boyer is with us today to share the work that she's doing around the Ending Forced and Coerced Sterilization in Canada bill and situation. I want to quickly introduce JSGS since this is being recorded online, and more fulsomely introduce the senator who's tremendously accomplished. So that will take me a little bit of time. First, I want to acknowledge that we're on Treaty 4 territory today. The school also operates on Treaty 6, and both those locations are the traditional homeland of the Cree. Often when I make a land acknowledgement, I stop and say something concrete that we're trying to do in partnership with nations or communities. Today, since so much of the story that the senator is going to share with us flows through Indigenous space, I think it's maybe more a bit of a recognition that she asked to spend some time with us this afternoon. Recognition, I think, of the work that we're doing. They will be fairly simple. It turns out that the ceiling mics are working, so we don't have to worry about mics in any regard. So long as the folks at the back are able to hear us, we could just have a conversation. And unless Jim Daschuk in the back gets very rowdy, I won't have to do any emceeing at all. The senator will take questions after she's done her presentation. So I think all of that's fairly straightforward, aside from a university president that just wandered in. They want to do from time to time. This is a forced and coerced sterilization. It's a big topic. It's at the edge of a lot of systemic problems in healthcare. To be honest, I think it's an issue that is easy to see as something sitting at the edge cases or historical cases. Really not. It's the hardest and most brutal case set of a series of systemic stories, of systemic issues. I'll try to listen to the presentation today with that in mind. Certainly something where I think women at their most vulnerable, but also kind of at their most joyful, are taken very drastic advantage of. It's stories in the RDID report are stark. Reminders of that. So Senator Boyer's joined us. As I said, it's a pleasure to have her with us. She is tremendously accomplished. So give me a little bit of time here to properly introduce her. She's a member of the Métis Nation with roots in Métis Nation, Saskatchewan, Manitoba, and the Red River. She started her professional life as a nurse and transitioned into law, and could add a little bit the academy. For 27 years, she's practiced law and published widely on Indigenous health and the intersections between Indigenous and Aboriginal rights and treaty law. She's a member of the Law Society of Ontario and of the Law Society of Saskatchewan. Received her Bachelor of Laws from the University of Saskatchewan and her Master's and PhD from the University of Ottawa. In 2013, she completed a postdoctoral fellowship with the Indigenous Peoples Health Research Centre here at the U of R, and was full professor and sometime Canada Research Chair in Aboriginal Health and Wellness at Brandon. Along with managing her law practice prior to joining the Senate, she was Associate Director of the Centre for Health, Law, Policy, and Ethics, and part-time professor in the Faculty of Law at the University of Ottawa. Previously, she was General Counsel to the Native Women's Association of Canada, legal advisor to the Canadian Nurses Protective Society, and an executive with the Aboriginal Healing Foundation, National Aboriginal Health Organization. She's a former Canadian Human Rights Commissioner and an appointed member of the Federation of Sovereign Indigenous Nations, First Nations Appeal Tribunal. You can also, and this is a very accomplishment, find her as one of 8 people from across Canada chosen to be a holographic narrator at the Canadian Museum of Human Rights in Winnipeg. She's a long history of giving her time to nonprofit organizations and the charitable sector. For example, she served on the boards of the Wasson Lodge Indigenous Women's Support Center, the Champlain Local Integrated Health Network, and Save the Children of Canada. 2018, for her many contributions, she received the Honorary Doctorate in Education from Nipissing, was appointed to the Senate on March 8th, 2018, International Day. She resides in Ottawa with her husband Marv, who's working the social media accounts. There are 2 dogs and 3 cats. She's the mother of 4 children and has 4 grandchildren. Please welcome Senator Yvonne Boyer.
Thank you very much for that introduction. And I just have to say that when I became a hologram in the Museum of Human Rights, my husband was overjoyed because he said he could unplug me. Anyway, thank you so much for the introduction and thank you for the invitation to be here today. I am thrilled, and I also want to acknowledge that we're on Treaty 4 territory, which encompasses the lands of the Cree, the Saulteaux, Dakota, Nakota, and Lakota, and on the homeland of the Métis Nation. The people of these nations are the original stewards of the land, and it's important to show our respect for their stewardship by acknowledging them at the start of our meeting. So I am Yvonne Marie Boyer. I was born and raised in Moose Jaw, so I'm coming home when I come here. Regina has many of my relations and Saskatoon does too, so I'm always happy to come home. I'm the granddaughter of Mary Rosalie Larocque and Louis Ama Boyer. They are Métis of the Red River. My father is George Boyer. He was the youngest of 12. My mother is Norma Linton, and she has her ancestors from Northern Ireland. So the focus today is on the issue of forced and coerced sterilization. So I've been working in this area for a number of years, and the 2 big questions that I get is, this can't still be happening, can it? And how did you ever get interested in this? So we're going to talk about these 2 questions today. As was my introduction, my work as a nurse and a lawyer has brought me to studying the intersection between health and the law in academia and in private practice. One day in 2015, Betty Ann Adam from Star Phoenix gave me a call. She said there was 2 people in her office that said that they had been sterilized against their will at a hospital in Saskatoon. They were Indigenous women. And she said, what should I do? And I said, well, that's against the law. That's really bad. You can't be touching people without their consent. That goes against international law, Aboriginal law. It's a criminal code offense. And I go on and on and on about the wrongs of having been sterilized as Indigenous women. 2 women that she was talking about is Tracy Benab and Brenda Pelche. And every time I speak about these issues, I talk about these 2 courageous women because they need to be honored and they need to be respected for bringing light to these horrible issues. After Betty Ann published her article, and after this article was published, 1 more person came forward, and then another, and then another, and another. And pretty soon there was 11 people, 11 women, same hospital, right after they'd given birth with a cesarean section. So, and they were all Indigenous. So Brenda and Tracy in the meantime went underground very silently because they were targets of vicious racist attacks on social media. And we haven't really heard anything from them since then. And that this is what happens and what has happened to these 2 women. But they started something that they can be very proud of. So not long after that, I had been given or been asked to give media presentations to various media outlets. There was probably 4 or 5 of them. And I was then contacted by the Saskatoon Health Authority. They called me and they asked for me and they said, we would like for you to do an external review of our tubal ligation policies at the Saskatoon Health Region. And I said, are you sure? Because I've been bad-mouthing you all across the country. And here's links to all of the articles where I've said, you know, what your practices, what I think of your practices. And they said, yes, we do want you to come and do an external review for us because the elders have asked for you. And so at that point, I said, if the elders have asked for me, and you agree to the conditions that I require, I will do this. So one of the conditions is the report had to be made public that I was going to come up with. The other condition was that I had to have the resources that I asked for, and I said, I won't be unreasonable. And I also wanted to have somebody with me and have myself and another person doing this external review. I asked for a co-author, and that would be Dr. Judy Bartlett, who I had worked with at the National Aboriginal Health Organization. And I had worked very well with her, and I knew that she knew the hospital. She was Métis, a Métis physician. And we were able to work very well together. So we embarked on this external review of the Saskatoon Health Authority's tubal ligation practices. And we set up interviews. We had a research assistant that spoke Cree. Our networks, we were familiar with. I come from Saskatchewan, she comes from Manitoba, and she had done work in Saskatoon. So we had the networks available to be able to be accepted within the community. We placed notifications of our wanting to interview people. We placed them where women would be. We put them in healthcare centers and anywhere that we could think of that Indigenous women would be. We had a hotline to call, and our research assistant is the one who spoke Cree to the people that only spoke Cree. The other thing that was really, really important at this point is we had an elder with us, and her name was Mary Lee. And she was with us from day one, and she helped us keep it all together, because this was a very difficult job, is to listen to women who had been so severely traumatized. And some of them had never, ever told their stories before. So when we were interviewing them, it was in a very, it was at Saskatoon, one of the hotels that had suites in Saskatoon. And it was, Judy and I were in, jeans and t-shirts and things, and we were comfortable, and Mary Lee was there, and we had tea and snacks, and it was as a safe environment as possible. And when the women were interviewed with us, they were able to bring somebody with them if they wanted to. And so when women told us their stories, sometimes they were so traumatized that it was difficult to go on. And Mary was in an adjoining room with us doing her work. And we would call her in if the women wanted somebody to come in with them. And so Mary would come in, and what she said is, I'm going to hug you back together. And I always feel very emotional thinking about this, because I envision, like, Mary is the warmest, loveliest person, putting her arms around you and holding you until you can stop crying because of the trauma. And so Mary played probably one of the most important roles during this time. And every morning it was difficult for Judy and I when we were doing the interviews, because we knew about vicarious trauma and how difficult it would be for us as well. So we prayed, and we asked for guidance and help to get us through this day so that we could help the women. And that's how the external review report, which I think we have at the back, that was the beginning of the external review, and we detail that in this document here. So the document was compiled with recommendation, and the documents I'm talking about are all printed at the back of the room there too. So this document was compiled and published, or put out, published on July 17th, 2017. And that was the beginning of the first class action lawsuit on this topic, and the beginning of more women coming forward. So what's happened since the report, since 2017? The first class action lawsuit was launched in October 2017. The certification hearing is happening this week in Saskatoon on this, 7 years later. And the first affidavits were filed October 2017. There's a second class action happening in Alberta. There's a total of 4 class actions happening across Canada right now, dealing with women. In Quebec, where I don't know if any of you have heard about the thing you're saying, there's no racism in Quebec. but they have a class action lawsuit happening on this topic, which I'm very glad to talk about. There isn't anything in the north yet, and that I'm sure will be remedied before too long. So in 2018, I was appointed to the Senate of Canada, and my very first speech talked about the forced and coerced sterilization of Indigenous women in Canada. My office has become a safe house, and I have helped women that have called me, and some men that have called me, that get the help that they need, whether it's retrieving medical records to help them find out if they were sterilized. Sometimes women would call me and say, I think I remember signing a paper, but I don't know what it is. And I've been trying to get pregnant for 5 years. And I've said, get your medical records and I'll help you decipher them. I've helped connect them with legal and health supports. And my office to date has counted 12,000 people. I deal with reproductive injustices, and all kinds of people call me or get in touch with me. And everything that I do and the people areas that I work in can be found on my website at www.senatorboyer.ca. So you can keep track of what's going on there as well. So I've been doing speaking events all across Canada, and it always seems that when I do speaking events, people talk to me after and say, happened to me. It happened to my aunt, it happened to my sister. Well, there's people that we don't know how many. We only think that it's a lot more widespread than what was currently thought. And most people think it's a thing of the past. Now, I want to just remind you a bit about the legislation in the country. When people ask me, how does this happen? This is just crazy. How come it happens? And one of the reasons why it happens is because of the eugenics legislation that was legislated in this country in the 1920s to the 1970s. And Mr. Daschuk could probably talk to us a bit about that as well. But, the eugenics legislation provided that people that were mentally unfit could be sterilized without consent. And that was valid in Alberta and BC, and it was on the Hansard records in many other provinces as well. So I believe that this underpins many of our healthcare policies that we have today, that it's okay to sterilize people based on public thing. So that's just one of my theories. So we know that it's changing. The more people that talk about it, that the more events that happen about forced and coerced sterilization, and the good things that have as a result, the more positive things that have come as a result of Tracy and Brenda coming forward in 2015. I call it seed planting because each one of you are going to take this message home and you're going to plant some seeds and you're going to be thinking about these issues as well. And that's how things get moving a little bit. But I want to tell you a story of how this happens, a real life example. I want you to meet Dr. Andrew Kotaska. And I always, for some reason, I have a hard time saying his name, so I don't know why. But he's a doctor who might be seen as a role model for young doctors or highly respected colleagues. He has served as president of the Northwest Territories Medical Association. He has years of practicing medicine as well as professorships at the Department of Obstetrics and Gynecology at the University of Toronto, University of Manitoba, and at the UBC School of Population and Public Health. He has published articles on caring for Indigenous patients and, surprisingly, informed consent and ethics. Andrew Kotaska is a former clinical director of obstetrics at Stanton Territorial Hospital in Yellowknife. Andrew Kotaska may be emulated as a leader at the successes of his career. In July 2019, via remote ultrasound, he diagnosed an ovarian cyst and decided that a 37-year-old Inuk woman needed surgery. He performed surgery to address a painful cyst on her right ovary at the Stanton General Hospital, Territorial Hospital in Yellowknife in November 21. She only consented to the removal of her right fallopian tube and ovary, if necessary. Andrew Kotaska removed her right fallopian tube and right ovary, and before he also removed her left ovary and fallopian tube, testimony heard by the inquiry board claims that he stated during surgery, "Let's see if I can find a reason to take the left tube." And with a quick slice of the scalpel, he left her sterile forever. A civil suit was launched in April 2021, and the Northwest Territories Health Authority and Katasca were sued for $6.5 million. They both filed statements of defense, and Andrew Katasca denied sterilizing her without consent. A year later, he publicly apologized. In his defense, he stated that his medical student heard the Inuk patient say she didn't want any more children. Andrew Katasca seemed to imply at that point that if an organ wasn't being used, it shouldn't be a problem if it was removed. An official complaint was launched against Andrew Katasca with the Northwest Territories Department of Health and Social Services, who licenses physicians, and a virtual hearing was held on February 10th and 11th in 2022. The Board of Inquiry found that he violated the Medical Association Code of Ethics and Professional Responsibilities. They suspended his medical license for 5 months, already served. He was ordered to pay $20,000 in costs related to the hearing, and he had to complete an ethics course at his own expense. The board considered a letter signed by his colleagues as an accomplished, thoughtful surgeon who is capable of excellent decision-making when they made the recommendations. Despite all of this, Andrew Katasca currently practices medicine in a hospital in interior British Columbia. He's fully registered with the Society for Physicians and Surgeons of British Columbia. In the meantime, I've been busy at the Senate of Canada. At the Senate Standing Committee on Human Rights, we completed 2 studies of the topic of forced and coerced sterilization, and both reports are at the back of the room. The very first report was a general review of the people that we heard from were people with disabilities, the people who are intersex, government. We heard expert researchers on the topic. We heard lawyers. Black women from Nova Scotia came forward. They were not only sterilized, but had complete hysterectomies without consent. The House of Commons also held a very interesting study, and both said more data is needed to really take action. In January 2020, the National Aboriginal Collaborating Centre had a conference with government and community leaders and said that they took a strong step in ending forced and coerced sterilization of Indigenous women and girls. And everyone in attendance committed to going back to their organization and work to have their organization adopt a declaration to end forced and coerced sterilization. Events over the last years have brought to light into the public eye racism in the healthcare system. We have Joyce Echaquan's death that sparked the federal racism in healthcare working group meetings, which I attended all of them. Before that was Brian Sinclair. There were hundreds that didn't make the news. The second Senate Standing Committee on Human Rights Committee studied the issue, and that's the scars we carry. And that one is also in the back. And we heard directly from the survivors. This was spine-chilling testimony. They call for this practice to be criminalized at this point. And I had always not really approved of wanting to criminalize the act of forced and coerced sterilization and the people that do it, because the criminal justice system has not been kind to Indigenous women. And so it was at this point where the women had asked me as a legislator, please criminalize this. That was a big turning point for me because I heard them. And one of the recommendations from the second report was the very first recommendation was to draft legislation and have it enacted in the Criminal Code of Canada, that it was a criminal offense to sterilize somebody against their will. That was the beginning of S-250. And I'll talk a little bit more about it, but I want to just read a little story from one of these real life stories. This is Liz. Elizabeth Escuega informed the committee that as a childbearing teenager, she was coerced into having an abortion, during which she was also sterilized, recounting that a child protection worker told her they would take the baby one way or another, and characterizing the pressure from a social worker and doctors as immense. Ms. Escuega described how she was kept uninformed about the sterilization procedure. In my case, I can't think of where I had an opportunity to speak with an actual counselor or social worker about the long-term effects of what I was going into here. That wasn't offered. All I recall is being in a small room with the doctor in a white coat and the social worker standing in the corner, and both of them taking their shot at me, so to speak. So when you read these stories, it's going to make you really think about what our healthcare system has done to these women. I'm going to leave that one because there's many more that you can read in there. So this second study, The Scars We Carry, did ask to have as a first recommendation, a criminalization of the act of forced and coerced sterilization. So after hearing and helping these witnesses come to the Senate to testify, which was very difficult. I don't know if any of you have ever been in the Senate committee rooms, but I mean, they're very sterile rooms, and there's a panel of people ready to ask you questions that you don't know. So it was very difficult for these women who had been totally traumatized just with the act of being sterilized. And I've asked them to come and testify at the Senate, and they did. It took a lot of, they were so courageous, and it took a lot of work with them. And they had somebody with them to come and testify. And I told them of how important it was for them to do that, because people will listen, and this will help stop the act of coercing and forcing people into sterilization. So the women really need to be congratulated for actually doing that. So I drafted the bill, worked hard with the law clerks of the Senate, and in June 2022, I introduced the first reading of the bill into the Senate of Canada, and to make it an explicit offense under the Criminal Code of Canada. That once it was in the Senate, now I'm not sure with how familiar you are with the process of how we make laws in this country, but when a bill gets introduced, a private member's bill, that's like me putting a member bill into the Senate of Canada, there's probably more chance of it getting bumped out of there than actually going through, because of government legislation will always trump a private member's bill. So once it was introduced into the Senate, it was then brought up into second reading speeches. It goes through 3 readings in the Senate, and then it goes into the House for 3 readings, and then it gets royal assent to become law. That's how a bill is passed. But it isn't just, you know, a hop, skip, and a jump into reading after reading. There's a lot of work that goes into it. This bill was sent to the Legal and Constitutional Affairs Committee, which is a very, very busy committee with, there's a good percentage of lawyers on the committee in the Senate, and it was scrutinized and debated, and then it was held in limbo for a number of months, where it continued to sit because government legislation was holding it there. It couldn't move out. It didn't move out until September 2024, and Bill S-250 unanimously passed 3rd reading in the Senate in October, and it was referred to the House of Commons, and it's now very close to becoming law. It's sitting in the House of Commons right now, and I know that it may get caught up in the election, but because it's in the House of Commons, we don't have to start at the bottom again if there's an election or a prorogation of the Parliament. So at the same time that Bill S-250 was being developed and studied, a new group called the Survivors Circle for Reproductive Justice was formed. And it's a national advocacy body for survivors of forced sterilization. These are comprised of women, Indigenous women who have been sterilized against their will. And remember, my office had counted 12,000. Well, the last count I heard from the Survivors Circle was 50,000 and growing. So we know that this is a problem. It's a national organization that will assist women with their healing requirements and support. And they're continuing to advocate to stop this crime from ever happening again. The organization is blossoming. The directors of the organization are matriarchs, they're grandmothers. There are survivors on the board board as well. So some of the items that are current, that is current at the Senate right now. So we know that Bill S-250 is waiting to be introduced for its first reading in the House of Commons. It may be introduced or it may not. We know that the certification hearing for the largest class action has started this week. My husband Marv and I were up there for the very first day. And actually what they were doing is arguing that this external review really wasn't expert evidence. The Saskatoon Health Authority was arguing that this was not expert evidence. So they were trying to have this dismissed, but I don't think that they will, well, I don't know. I doubt if they'll be able to do that. The Survivors Circle held their first AGM and public launch in October, and it happened to be the same time as the bill was actually moved to the House of Commons. So it was quite a wonderful celebratory event going on in the Senate of Canada. They are planning their first national gathering. So keep your eyes tuned, your ears and eyes tuned to the Survivors Circle for Reproductive Justice. If you look on Facebook, they have a presence there, and they're becoming much more, they're growing very rapidly. So many more women are coming forward. The last one that I know was sterilized was December 2023. There's an example in the scars that we carry of a woman who was 24. And 2018, she was sterilized against her will, and she had 2 children. There's one final story I want to talk to you about just before I'm finished. A few years ago, and this is just how pervasive this is I was checking into a hotel in Saskatchewan here, and it was late at night, and I rolled my suitcase in, and I was the only one in the lobby, and there was a clerk behind the desk, and I said, "Hello, I'm here to check in. My name is Boyer." And she said, "Oh, you're the senator." And I said, "Yes, I'm senator." And she said, "You're the senator of sterilization." And I said, "Well, that's what I work in, but it's not my title." Work in that area. And then she looked at me, and I looked at her, and her eyes got really big and they started to fill with tears. And she said, "They did it to me." And I looked at her, and I mean, I got chills just talking about it. She said, I was 21 when they did it. I had 4 children. They sterilized me when I was 21. I'm 35 now. My children are grown, and I want to have more children, and I have a new partner, and I can't afford IVF. And I mean, I'm crying, she's crying, and we're holding each other. And I said, "I know I can help you. I can get you some legal advice." It's, you know, and I mean, that's just an example of how common this is. She's part of this, the survivors group, and there's many that have contacted me that are part of the survivors group. They support each other, and they're really doing a wonderful job, and I'm very proud of them. They've got funding from the government for now, and I'm hoping that they are the beginning of seeing a national body that oversees all of the areas that it requires. It's not just the criminal code that's going to stop this. It's not just it's not just legislation. It's not just the class actions. It's policy. It's getting the data. There's so much that needs to be done in the research area that needs to be done with the national advocating body, looking at it all throughout Canada. So I envisioned something like the Aboriginal Healing Foundation. That was a $350 million trust fund that was put together by the government to address the healing needs of the survivors of physical and sexual abuse resulting from residential schools. So I envision the same type of organization that can provide healing for women that have been victimized of this horrendous crime. So that's all for me today. I'm happy to answer any questions. So thank you, Marcy, Miigwech, and I'm here for questions.
I just want to ask, like, given all the stories that you've shared, like, are there a lot of Indigenous women who like are even afraid of going to the hospital or entering, like, using healthcare services given everything that's been going on?
Yes, that's a very good point, because that's what we heard in the external review, is the women that have been sterilized will not go to the healthcare system, and they suffer because of it. And their families suffer because they don't trust the healthcare system. They don't go for their pap smears. They don't go for their proper healthcare. And that's another area that needs to be addressed by the survivors group for all of the women. Thank you for bringing that up. Yes.
Thanks very much for your talk, Senator Boyer. It's super important. You were talking about the criminalization, the bill you introduced. One of the things I've been working on is anti-racism in healthcare. I work with the team in Athabasca, and I'm sure you're familiar with In Plain Sight from British Columbia. Is the group working with healthcare professionals, community medical association, anything like that? Train up?
Yes, they are. And actually I have worked with, we've had full support of the Canadian Medical Association, the Society of Obstetricians and Gynecologists don't want to see any doctors go to jail, but they're very keen on stopping this practice as well. So they've testified, and I've been working with them over the past several years as well. The survivors group, I believe they are working with them, but I just don't know exactly what yet. But that's a very good point.
That's yet to be resolved. You probably heard the story of the Métis elder in Saskatoon had his leg cut off. There was someone from Manitoba had the wrong leg amputated a couple weeks ago in Winnipeg. So like it's a kind of a continuum. That's just the most egregious thing, but still going on.
Well, I mean, I had mentioned I was on the federal working group before meetings that they had, but the one issue is that I've said to them, where are the survivors? Like, we need those people to come forward and talk. You can't tell them what they need. They're going to tell you. And that's the same what you're talking about. You know, the people, that poor man that had his braid cut off, let's listen to him. You tell me how to fix it. And the same thing with it's terrible. I just get absolutely enraged when I hear about these things. I mean, like I said, Joyce Echaquan and Brian Sinclair were just the ones that came forward. There's hundreds more behind them. Yes.
Thank you for your talk. Really appreciate it. How's media coverage been on this? How would you describe getting knowledge of this out to the public at large?
My very first speech that I did about the issue.
Question, we couldn't hear it.
Pardon?
Can you repeat the question? I could not hear it.
Asked about media coverage. How have they been as far as getting the issue brought out for all of Canada, I suppose. The media coverage, the Canadian press, my first speech, they did a big spread on that, and that was the Associated Press. And then the Globe and Mail has followed me all the way through. They've been pretty good at it, but still, you know, it's not enough. I mean, people are still surprised at it. People are always asking, you know, like, how can this be? And it does. It's happening today. We know it's happening. And the midwives, I have to mention, the Indigenous midwives have been very important in protecting women and preventing these kind of things from happening. The other thing is doulas. We've talked about doulas, Indigenous doulas helping women that are in labor, are protecting them. What happens is the Indigenous women go into the hospital, or sometimes they have birth alerts already. So they're already sunk once they walk through those doors with the birth alerts and the birth alerts come when you've had contact with social workers. So you get a birth alert on your file, or in Saskatchewan, you have an R on your health card that says you're a registered Indian. Of course, you know, so it can be more. There can be more.
Birth alert. Can you please tell me? I don't know what a birth alert.
A birth alert, when a woman walks through the door
Mhm.
and she has her file, There's it's a red flag. He asked what a birth alert is. There's a red flag on your file that say that you need to be checked out because you've had contact with social services. Whether they have, even called social services for one reason or another. I mean, I have 4 children. I called social services. I would have a birth alert on my file. And there's class action lawsuits happening about birth alerts as well in Saskatchewan and Manitoba. Because as soon as you walk in, you're targeted.
Thank you.
So. More media coverage. Yes, we need it. Yes.
I'm wondering, should a woman come forward? What's her first step? Accessing her medical records?
If somebody phoned me and they wanted some help, I would ask them what they want first. Ask them what you want. And sometimes they just want somebody to talk to. If they have a question about whether or not they were sterilized, then the medical records are going and getting an ultrasound and making sure that, but that's something if they're looking at legal, I won't tread on the legal areas because I'm a senator, but I know people that do. I can send them over to other people that do work in the legal area that would help them with that. But if they are just wanting to know as a step, I'll help them get their medical records.
Thank you.
Okay,
Can I ask one more question, please?
yes.
Does this happen in your view? Is it couched in doctors making decisions that they have almost like a paternalistic, almost godlike attitude? They think this is, why do you think this happens? It's besides the roots of it being eugenics, but is there more to why it happens now in your experience? Do they make judgments of what they think are right without any? Just trying to understand that.
Okay, so the question is, why do doctors do this? And it's the powerful and the powerlessness. That's one of them. And I've interviewed doctors that have done it as well. And asked them what they thought about racism, and they denied that there's any racism. There's no racism here. And it needed to be done. And for the greater good, because they can't take care of their children. Or it has something to do with they don't, I mean, the comments that I get about that are racist as far as passing judgment on women, Indigenous women, it's terrible. And this is probably the people that don't sign their name, and even people that do sign their name that email me that say that, how else are we going to deal with the population of Indigenous women? These are things that I heard when I was nursing, and I still hear them. And people have said to me, the only way that we're going to solve this problem is if we sterilize all the Indigenous women. And these are healthcare professionals that have talked to me like that when they think I'm like them, but I'm not. So it's not the majority. I have to say, it's not the majority of doctors that do that or think like that, but there are some that do, that have to be stopped. And that's why we have Bill S-250. And it's going to be a deterrent. It'll be a very good deterrent because we have, look at Andrew Kataska. Would he have done that slice of the left fallopian tube, had he been thinking there might be 14 years in prison if I'm convicted of this? Probably not. So I think that is going to be one area it's going to prevent it in. And I'm hoping that it'll be a shift too. But in 2017, there has been a big shift. There's been a lot of people talking about this. All of the things that I've talked to you today about has been what's happened since 2017. We've moved forward. Each one of you are going to take this information and move it forward a little bit more. You may know people that have been sterilized. If you do, contact my office. You can find me on the internet. Contact my office. I will talk to anybody. And I'll help wherever I can. Stop this.
Thank you very much.
Yes.
Talking about that power imbalance, just a couple of years ago, there was a PhD student from Johnson Shoyama that wrote about cultural safety, and so that's something that's being introduced, but it's not mandatory here in Saskatchewan. I think every service provider in Ontario has to take that program.
That's a very good point. That when we first started this as well, the government had said that, we're introducing culturally relevant safety or education requirements. And that's great. That's a really, really good start, but it's just a start. It's just one of the things that needs to be done. And it needs to be mandatory. Although, sometimes I do think about the people that don't want to learn, won't learn, but it's something. Yes, in the back.
Yeah, so I'm still thinking about
Sorry, what?
the birth alert. It's something new to me. And I would like to sort of get to know more about it. I'm confused about the main reason for that or the purpose behind the birth alert. So is it like a label given to individuals signaling something to help professionals to sort of just sterilize you or something like that? I just really understand it.
Well, the labels, I don't know. It's almost, it's racist. It's complete racism is what it is. It's racism and discrimination based on somebody's perceived notion of who you are. And it's wrong, completely and utterly wrong. And you're right, it's the labels. People are quick to label other people. It has to stop. Just a sec.
I have to say, I did know that it was happening, but 50,000, staggering number. Which kind of tells me that this is more prevalent in the health system. To think it's not one bad doctor. So I'm curious if there's anything being done to facilitate internal reporting. Because it's so difficult for the med student or for the nurse or for the people who are in a position to see this. Like, how did they go about saying, hey, I saw this and it was.
I was asked to give a talk to the medical students at Laval University. And that's an absolutely critical point, because what do you do if you're the lowest person in that? You've got the least seniority, you're the teeny tiniest voice, and you're just learning, and you're told to hold those legs. What do you do? So I can't say what to do, but I put it back to the medical students. And I said, what would you do? Like, let's talk about it. Let's get that conversation going. I can't say because I don't know, but like I said, ask the survivors what to do. The medical students are the ones who will know the answers, and get the seniors in there. So let's start those conversations about what do you do if you're stuck in that situation where somebody's telling you this woman's going to be sterilized, whether she likes it or not.
Within hospitals, even to know if there's somebody, like, is there an advocate or is there someone in the hospital that maybe without jeopardizing.
I didn't hear what you just said at the last.
Sorry, I said without jeopardizing your career.
Yeah.
The person who is supervising you is also, and you see it in policing, you see it in a lot of areas where that's how racism gets perpetrated, is these students come in and they know that they're never going to do this. Yeah. But the culture that they're brought into doesn't leave preventive. Curious if there's anything to change the culture.
That's a really good point. And that's something that, probably the survivor circle has on their list of things to do. Because you see how much work there is to be done. Even in this room, we're identifying stuff that I don't know. I don't know what the answers are, but I do know people can figure it out. I know, I have total faith that issue can be dealt with. But you get those people together and start talking about it. And that's the point, is like, let's communicate about it. Let's not like hide it. Let's not talk about it. Let's talk about it. And talk about those feelings and what it feels like to be there. Stop it. Yes, like, we just missed, I'm not, are you, help?
I think we've got about 5 minutes left, and yeah, I can see the questions starting to flow, but you have a better view from the front of the room. So I'll say we've got about 5 minutes,
Okay,
and I'll let you pick the hand.
okay, I'm not sure whose hand went up first.
I can go.
You,
Yeah, I can go. I think you already. Okay. Okay, sorry. The question is regarding this whole issue of forced sterilization. Part of my research is on income inequality. What I've read so far is that income inequality is largest, the lower end of the spectrum. In terms of the status of this being forcibly sterilized, I'm thinking, what is their economic status, for instance?
okay, it actually affects everyone. Everybody. Yes, we have Nicole Rabbit, who's one of the board members of the Survivor Circle, who is a principal of a school. And she has been sterilized, and her story is in The Scars We Carry. So just have a look and read Nicole's story. And
Was she sterilized as a school principal? And how educated was she about the topic? She was sterilized.
oh, she was not. No, she was not. She was not educated about the topic at all.
Probably maybe more awareness about the topic among Indigenous.
Well,
and
I
visible.
probably, yeah. I think that's another area that the survivors need they've talked about educating the women themselves and educating the systems, but educating the women to find out what are my rights? You know, like, I don't have to, I mean, you read some of these stories and, you know, Sylvia Tuckenow was trying to get away in a wheelchair and they hauled her back and then sterilized her as she's screaming, no. Yeah, it's the women need to be educated. The next generation needs to be educated. Nicole Rabbit tells a story about she was sterilized, her mother was sterilized, and her niece was sterilized. So she comes from the Blackfoot Reserve. Okay, so what happens? You've got a generation that's not in existence anymore. You don't have the young people to take care of the older ones because they've been wiped out. They don't exist. So you have a threat to the community of non-existence because these women have been sterilized. So there's much more. You see, there's so much more work to do. You've pinpointed it right there. Like, women need to know what their rights are. I have a right to say no. And the more women that say no, and the doctors are going to have to think about that 14 possible years, then, you know, maybe things will slow down somewhat. Yes, in the back.
Okay, I was just wondering, are you working at all with the Federation of Sovereign Indigenous Nations Health Ombudsperson Office?
Oh, am I working with them? No, I haven't, but I have worked with FSIN in other areas and within the sterilization area as well, but not the ombudsperson office, but that's
It's
it.
a new office, and so
You need to be in touch.
of having someone there to go.
That's a great point. They need to be connected with the Survivors Circle. And that may be able to access people that wouldn't normally have access. So good point. That's a great position. That's a new position.
It's a new office, yes, newer. I don't know if it's a year old yet.
Okay. Well, that's
I
good
have
to
been
know.
Contacted, they're very supportive.
Yeah, I actually, I'll mention it to them when I talk to the survivors again. Yeah. Okay,
Very last question.
okay. Oh, over here, okay, over here.
Okay, so I would like to understand the type of sterilization method that were used on these women. Because with regards to the woman that you encountered when you were doing your hotel check-in, if the method was like bilateral tube ligation, I think medical science has made headway and then can just easily reverse it. So I would like you to throw more light on the type of sterilization method that we employ.
Type of sterilization?
Sterilization method, and there's new methodologies too.
Oh. Yeah, I don't, that's kind of out of my realm. I don't know. And I don't really want to know. What they've done is, like, some of the women that have been sterilized were sterilized a long time ago. They were sterilized in the Charles Camsell Indian Hospital. They were sterilized, they were taken from northern Quebec and moved down to Montreal to be mass sterilized. They're 26% of the women in Igloolik that were sterilized. 26% of them. So, and it's happened over the years, like this, our count comes from the 70s up until 2024. But the methods have all been different. Some were, I mean, you can't just like tie them up and untie them. Like the sterilization is a permanent procedure. People have had them reattached, but it's generally thought to be a permanent procedure that is not reversible. Whereas sometimes women were coerced into it. Nicole Rabbit's story is that she was told after she gave birth to her fourth baby, and she's on the operating room table with after her cesarean section, they told her it was reversible. And she's educated, well educated. I don't know. I mean, I don't think there's an easy way about that at all. It's a topic that, I hope that I won't have to spend the rest of my life talking about.
I think like a lot of people in the room, I'm shaken, but I'm shaken because it's so believable. So I want to say thank you on behalf of the school for sharing with us today. I'm sure these stories don't get any easier to share. I know some of us will stay afterwards for conversation and stuff, but thank you very much.
Thank you.